I remember the day that I got that phone call. I had just moved to Odessa and was out buying groceries. The news that my aunt had cancer stopped me in my tracks. The aunt that I have tons of pictures and memories of me and my sisters wearing dress-up clothes and spending countless numbers of magical Christmases at her house. The aunt who with every year we grew closer and closer to and formed an inseparable bond. A bond that was so strong it did not waver when she told me that she did not want any form of treatment for her cancer. Today, I'm going to talk about the benefits of chemotherapy. Finding out that my aunt has cancer and is refusing chemotherapy and treatment got me on the track to looking and researching different procedures for her cancer. She's a little older and maybe didn't understand exactly all the benefits of the treatment, and these points I'm going to make are what I would expect a doctor to explain to an uncertain patient with cancer. I will explain what cancer is, how chemotherapy works within the body, how treatment works, and some of the side effects of chemotherapy. Many people should understand exactly what cancer is. Cancer is caused by an uncontrolled division of abnormal cells in a part of the body. There are many treatments that you can take to help fight off cancer, such as chemotherapy, radiation therapy, targeted therapy, surgery, and many more. Chemotherapy is one of the least invasive and attacks cancerous cells directly. It helps to stop cells from dividing and spreading. Chemotherapy can also attack cancerous cells in any part of your body. As a cancer patient, you may be scared of the idea of chemotherapy because of things you may have heard or seen on TV or through other people. Now, you can take these sessions at home or through a pill. You can also take sessions in a chemotherapy unit through an IV. Now, the sessions depend on the type of cancer that you have and the type of treatment that you need. When I toured the St. Luke's Hospital in Houston with my aunt, we spoke to a patient. She was on her last treatment and had a total of 8 sessions in a 6-month period. And these sessions could last from a few minutes to a few hours. The Macmillan Cancer Support website described what a chemotherapy session was like. And during a session, you sit in comfy chairs. You don't feel anything during the treatment, and you are allowed to eat, drink, read, or sleep. You could even bring family members, friends. You could use this moment to relax. Some of the side effects usually scare people, such as nausea, hair loss, fatigue, or feeling sick. But if you do experience any pains or discomfort, there are things that the doctors can do to help counteract these effects. Increased risk of infections does happen, although not everybody experiences these pains. It does depend on the type of chemotherapy that you have, and everybody reacts to things differently. Survivor Sally R. from CancerTreatment.com says that she experienced mental side effects from her chemotherapy, such as a lack of organizational skills and a lack of short-term memory. She is a 4.5-year cancer survivor. I can't really give you any statistics about the survival rate of using chemotherapy because it does depend on the type of cancer that you have and the type of treatment that you need and the stage that your cancer has progressed to. But I do believe that experiences are a small price to pay for a cure and to live your life with your loved ones. Doing a chemotherapy treatment is better than doing no treatment at all. Finding out that my aunt had cancer made me not only think about my aunt's health and her well-being, but mine as well. I could be at risk to have the same cancer that she has. It seems that every time I talk to someone they know or them themselves has cancer. My aunt having cancer opened my eyes to a life that I may not be able to avoid. So learning about these different cancer treatments, such as chemotherapy, will allow me to become more knowledgeable about things that I may have to face or that other people are facing right now. Finding out that you have cancer is not a death sentence. It is a chance for you to come together with family and friends, and you have to understand that doctors and scientists are working hard to increase survival rates and eliminate cancer altogether. Giving up and having a negative attitude is shown to decrease your quality of life in an article from cancer.org. Tension, anxiety, depression, these all decrease your mental health, which interferes with having a positive attitude. If you do start to have negative thoughts, it is okay. Cancer is an adjustment, but just know there are family, friends, doctors, nurses, support groups that want to help you feel comfortable and help you fight cancer. Thank you.